Everyone. My name is Dr. Ramya Radhakrishnan, and I am a second-year internal medicine resident at Boston University Medical Center. This project was done under the mentorship of Dr. Yuri Avissar from the Department of Gastroenterology at Boston University Medical Center. So your doctor told you that you have fatty liver disease, but where do we go from here? The most important part of being an active participant in your medical care is feeling empowered to ask questions. Receiving a new diagnosis can be scary and overwhelming, leaving many of us with no idea on where to start. I'm a firm believer that knowledge is power, and so my goal today is to empower you with the knowledge to understand your condition better. First of all, where is the liver? The liver is an organ on the right upper side of the body. I call it the head regulator of the body because it can process good nutrients and break down bad toxins. I also call it the factory of the body because it makes proteins, important fats, and a substance called bile, which carries away waste and breaks down fat during digestion. Fatty liver disease occurs when fat accumulates in your liver. You may see it referred to as metabolic dysfunction associated steatotic liver disease, or MASLD for short. Over time, this fat can cause inflammation in the liver and eventually cause scarring, which is known as fibrosis. When healthy liver cells are replaced by scarring, over time, the liver is unable to perform its vital functions. Now that you have a grasp on what the disease is, here are some questions that you can ask your doctor at future appointments. Firstly, what symptoms should you look for with MASLD? MASLD is sometimes called a silent liver disease because it can happen without causing any symptoms. This is why diagnosis can sometimes be easily missed until later stages. It's also important to talk to your doctor about risk factors within your medical history that could put you at an increased risk for MASLD. For example, high blood pressure or diabetes, since part of the treatment revolves around treating the underlying conditions. Also, make sure you talk to your doctor about how often you should come back for repeat lab work and imaging to check on the status of your fatty liver disease. Although medications to treat MASLD is a rapidly evolving conversation in the field, unfortunately, there are no approved medications for treatment at this time. Research does show, however, that weight loss and changes in your diet can reverse fatty changes, especially in the early stages of the disease. So it's important to ask your doctor about changes that you can make in your lifestyle. The most important thing that I want you to take away from this talk is that you are not alone in this journey. Taking care of your health is a team effort between you and your medical providers, and there are many ways to get connected with resources like exercise programs, support groups, and even new research trials that you could ask your doctor about. I hope this talk provided you with the starting tools to empower you in your health journey. Thank you so much for your time.